Hello and welcome to The View from 4 Feet and 3 Inches. I'm your host, Cassidy Huff, and you might notice that there is not a virtual guest on screen with me right now. That's because this episode is a little bit different than all of the other episodes that I've filmed so far. So this episode I filmed with my surgeon who did probably over 15, maybe 20 of my surgeries, which is wild. And I've actually split this episode up into 2 parts. So this is part 1. I do want to give a trigger warning because we do talk about surgery and medical trauma, as well as some pretty gruesome details of my surgeries that I went through regarding halotraction and spinal fusion. So if that's not something that you are able to stomach, or you get a little bit queasy talking about things like bone grafts or blood or anything like that, you might want to sit this one out. Let's dive into the episode. Hello and welcome to The View from 4 Feet and 3 Inches. I'm your host, Cassidy Huff. I am a white woman. I have black-rimmed glasses on. I have baby blue podcasting headphones on. I have a cropped off-white sweater. I'm sitting in a faux leather chair, and I have a wonderful virtual guest with me today. My amazing virtual guest is my surgeon, Dr. Klane White. Hi, Dr. White.
Hello, Cass. How are you?
Good. How are you?
Good. Very good. Glad to be here.
Yes, me too. Do you want to do a visual description?
I can certainly do that. So I am an older white male in my mid-50s with less hair than I had 30 years ago. No glasses, no headphones. And I'm wearing I'm not sure what color this is. It's kind of a grayish, bluish button-down shirt.
Yeah, there you go.
How's that?
Amazing. That was great. He was really nervous about that. He nailed it. Okay, so Dr. White has known me. We go way back, truthfully. We go way back. I think he's known me for at least 15 years.
Yeah, 2008 probably, 2000 or so.
So I was 6. That's wild.
Yeah.
So he's known me for a long time. Before we get into my case and all the complexities of Cassidy, we are going to talk about why you became a surgeon. What was your upbringing like? Why did you decide to go into this field?
Fantastic. Do you want me to go ahead and start, or go for it?
Yeah.
Okay.
Go for it.
Well, I guess if I want to go way back, so this is a long time ago now. I grew up in Southern California, not far from where you are. I grew up in a town called Carlsbad, beach town. Pretty idyllic, and very suburban.
That's where Legoland is.
Exactly. It was not there when I was growing up. Those were, strawberry fields or tomato fields. But yeah, I grew up there, and I lived there through high school. I'm one of 7 kids, so big family. My father was an obstetrician, was in medicine. None of my siblings went into medicine, but so I'm the sole one who's gone into medicine. They've all, been very successful in their own right, but in different forms. And then from there, I went to college at the University of Southern California in Los Angeles. And I stayed on for a couple extra years and did a master's in oceanography there. So that was a great, fun time to spend in my, late teens, early 20s.
Oceanography?
Oceanography, yeah.
Why?
Because it was fun.
Okay, I love it.
It was fascinating science. And maybe that could be part of the story as to how I ended up where I am. But so I'll explain that in a second. But that is where I met my wife in college. So while we were there, we got married. So I got married at a young age. I was 22, and so now we've been married for 33 years. So anyway. So oceanography, I was, as an undergraduate, I was a biology major, and I spent a semester at Catalina Island, loved it, and decided that's what I wanted to do. And I did that for a couple of years and truly did love it, but started thinking about life and how long it would take me to get somewhere, and mistakenly thought that it'd be a little faster to actually go to medical school and get trained in medicine and have a reliable job. And so that turned out actually to be extraordinarily a false premise.
I was going to say that's interesting that you thought it was going to be faster
Yeah.
that way.
Yeah, seeing as to how I finished my training when I was 36. So, but that's also part of my story. So, yeah, from there we moved to Washington D.C. and I went to medical school at George Washington University in downtown Washington D.C., where I fell in love with orthopedics as a specialty. And so from there, I moved back to San Diego. So that's where I did my training in orthopedic surgery, where we call it residency. So that's generally 5 years for orthopedics. I made it into 8. And again, that's a big part of my story. So I had my first daughter. We had our first daughter when I was just starting residency. So and then we had an assigned research year, my second year of residency, and so we had our second daughter at that time, and so a year later, we just like you, we noticed something was different about her back. Actually, she was only about 6 weeks old when we noticed, and so. Probably much like your family went through, we were like, there's something something different here. Not sure what's going on. And about 6 months later, she was diagnosed with a different, very rare condition called Hurler syndrome. And so that was my daughter Susanna. And just so I'll name my other daughter's Madeline because she's still,
We love Madeline.
wonderful part of my life. So anyway. Anyways, we had the only real treatment for Hurler syndrome is a bone marrow transplant or a stem cell transplant. So, as you'd imagine, this is like what they do for cancer patients, and it's when it's the last resort for cancer. They basically clear out your bone marrow and then give you someone else's bone marrow. And the idea here is that this condition misses an enzyme, and that enzyme can be replaced through a bone marrow transplant. That was about a 2-year process in which she nearly died at least twice. Eventually, though, we got her back to San Diego. But she never really got over the transplant. She was having a lot of issues with a reaction to her transplant, the transplanted blood cells, what they call graft versus host disease. And so she was on immunosuppression for her whole life. And I guess in the process of working this all up, knowing that I was in orthopedics and I was working at the Children's Hospital doing my research, and because I needed to take extra time off to go help, get her through this process, I ended up doing extra 2 years of research.
Oh wow!
And in that time, it occurred to me that really, like Conradi-Hunermann, Hurler syndrome, and other genetic skeletal differences, conditions, there was almost no research on it. There was nothing known about it. And the San Diego program was a very academic program. And so it inspired me to say, hey, let's learn more about these conditions. Let's really become an expert on it and learn how to take care of these kids in a way that no one else knows how to do. So that was, really the impetus for that direction in my life. So from there, I finished my residency, went to Dallas for a year, did pediatric training, and then moved to Seattle, where we met. Unfortunately, within a year of being in Seattle, the graft versus host disease kind of went rampant and overtook my daughter, and so she died 2 years after that. So in 2008, probably about the time we met. So.
Oh wow! I didn't know that.
Yeah. So anyway, so that's a big inspiration for what I do, clearly.
Mm-hmm.
But it's so much more than that. It's just because now it's become not just about her, but it's become about you're not a kid anymore, but kids like you were, lots of other children who have these conditions that really, if you go to any regular hospital, that they might have heard about it in medical school, maybe.
Possibly,
right? So and so I've taken it from there and really just made that my mission to do
Yeah.
that. So sorry, that
I
was
mean,
really long-winded,
no,
but
no, don't apologize. That's what this whole thing is for, is to be long-winded. So thank you.
okay.
Yeah, I struggle anytime I go to I've had to go to the like urgent care a few times
Hmm.
here in Southern California, because of pneumonia or whatever. And I walk in and they go, and I'm like,
Let me
hi,
do this.
I know what I need. Listen, do you want me to call my pulmonologist? He'll tell you exactly the same thing I'm about to tell you. Give me a Z-Pack, I'll be fine. I'm great. And they're like, I think we need X-rays, and I'm like, you're not going to be able to read them. So if you want to try, you can do it. At one point, they were confused about the hardware in my back. And they were like, do you have anything on your heart? And I was like, no. And they were like, are you sure? And I was like, fairly certain. And they were like, I was like, can I just read my own x-rays, please? And they were like, we can't let you see those. And I was like, are you sure? Because I've seen my own x-rays a lot. Because like you would be in the room being like, you want to see this? Here. This is
Yes.
where things are. And I'd be like, interesting. They refused. They would not let me see my own x-rays. And
Right.
then this woman was like, so what do you have? The provider was like, what do you have? And I was like, it's called Conradi-Hunermann syndrome. And I explained it all about what it all is. And she was like, interesting. She's taking notes as I'm talking. And I was like, you've never heard of it before, and maybe once in medical school, but never after that. And she was like, this is so interesting. I'm going to have to tell my boss about this. And I was like, thank you.
Your case
So
study.
it's like, yes, always. I'm always a case study. That was like when I moved down here, I was like, what am I going to do if I have to ever have another surgery? I can't just walk into any hospital. They're going to be like, who? What? Who did this? What? Why? Why do you look like this? So, I think it's really interesting that you were already in pediatrics and orthopedics when your daughter was born.
Yes. Yeah. That was pretty early in my career, but yeah. Yeah.
So did that help then throughout her medical journey?
It's a mixed, it's a double-edged sword, I guess I should say.
Yeah. Were you a little too educated?
Maybe, yeah. I was, and my wife Amy was as well, right? I mean, it's kind of like you and your mom. You walk in, you know, kind of really what you need, right? And don't mess around. Just
Do
sometimes
it.
you need to rely on people's expertise who actually know what they're doing, right? But a lot of the time, you go into these situations where it's something that's relatively straightforward. You just happen to be a little different, and that throws off the whole equation for them. And so we did have to deal with that a bit as well. And even being on staff in the hospital, I mean, there were goofy things where like and I did a whole video on this in terms of communications with physicians and other staff. I would, and when my daughter was in the ICU in Seattle, I would walk into the operating room was right across the hall from the back door to the ICU. And I would use my badge to go through the back door. And the nurse tried to tell me I couldn't go through the back door. And I'm like, I can use the back door. Why not? I have a badge that tells me I can. And so there sometimes you get into these kind of power struggles about really dumb things.
Yeah. Where you have to figure out like when am I the dad, when am I the parent, and when am I the
Yeah.
physician?
Yeah, and I mean, so I was always very careful though not to kind of not to like try and pull rank or whatever, right? I mean, because
Yeah.
I mean, we did really rely on the expertise of our ICU doctors, our hematology
Sure.
oncology doctors, our bone marrow transplant team, right? I mean, I don't claim to be an expert in those things. I understood it,
No, and that's not your specialty, right? So
right?
you're just like, this is kind of out of my
But
field.
I had to know it pretty well, so I knew it better than 99% of the people, just not that small percentage of people who really So, that did make it interesting.
Were you ever like with residents in your room where you were like, you're
oh yeah,
wrong,
oh yeah, yeah.
Klane, get out?
Well, yeah, yeah. I mean, yeah, that sometimes, so you could really see who was a good resident, who wasn't a good resident. And I understand the teaching hospital thing,
Sure.
right? I'm an educator. I have trainees with me. I've always had trainees with me, but it's about educating them about how to interact with families and, when to not acknowledge that you don't know the answer. And sometimes that's hard for people in medicine, especially early on in their training. They don't want to admit they don't know.
Yeah.
And
Well, my
so,
mom was the same way. She was
yeah,
like, get out. Actually, you don't know what you're talking. I mean, she
yeah,
kicked people out of my room because she
yes,
was like, don't like them.
yes.
They blinked wrong. Get out. Get them
Yeah,
out.
yeah, I know she's a good strong parent, and my wife was the same way. I didn't usually do that. I kind of left that dirty work to her, because she was. I mean, I was so through almost all this time I was working.
Yeah.
So she was in the hospital over for almost a year straight in the end, and but I was working and doing all this, just kind of. But they were sleeping in the hospital every night, and sometimes I would sleep in the hospital, and my wife would go home and.
And then get up and go to work at the
Yep.
same place.
Yep. Yeah. Yeah. I got to know the bike locker room showers really well.
Mhm.
So
Yeah. Yeah. I would think that would be difficult.
it was, yeah, I don't know. It wasn't that hard. It was just, it was just different experience.
Taxing. Yeah.
Yeah.
I'm a one-woman show. That means that I write all of these scripts, film all of these videos all by myself. But I also have a team of amazing editors. And as you can imagine, it costs some money to be a 23-year-old entrepreneur. So that's why I started a Ko-Fi. And so many of you were asking how you can support me being able to do what I love and make videos for all of you. That's why I started a Ko-Fi. If you head on over to my Ko-Fi and drop a donation, you automatically become a representation booster. And I shout out one representation booster in my weekly YouTube video. So head on over to my Ko-Fi, drop a donation, and who knows, maybe next week I'll shout you out. Back to the video. So, let's move on to me.
Okay. Let's talk about you.
It's my favorite
Our favorite
subject.
subject.
And yeah. So we met in 2008,
Yeah.
you
Ish.
said. So that would
Yeah.
be, I was 6. So for those who don't know, could you explain what my syndrome is in your own words? Because I think people are tired of hearing my explanation of it.
Yeah. I mean, depends how deep you want me to go in genetics, but, it is an inherited disorder. And I can say your mother has it as well. So,
Yeah, she
but
tested
but
positive for it.
yeah, so but it's interesting the way it works. So it is generally a change in a protein we call elastin binding protein, and it's actually a disorder of cholesterol metabolism. So which then
I
affects
didn't know that. You're
yeah,
educating me.
yeah, then it affects the bone growth, right? So um,
It's all coming together now. Okay.
yeah. And so it's actually its technical name is chondrodysplasia punctata X-linked dominant type 2. So CDPX2 is the
Okay.
actual is what is if you were to look it up on a genetics website. And it's an X-linked condition, meaning that it's generally only in girls. If boys get it, it's lethal.
Yeah,
So
that's what I've heard. I only know one boy
yeah,
who's alive
yeah,
with it.
and that has to do with the way that it's on the X chromosome, and there's this thing called X inactivation, where a certain number of the X chromosomes get deactivated. And I'm not an expert in this, so I don't want to get too deep into it, but how much of that X inactivation occurs is what determines how severe the manifestations are. So your mother has less inactivation than you do, which is why she's less affected than you are. So,
Yeah, I think Dr. Mosca,
mhm,
maybe. It might
maybe.
have been Dr. Mosca. It might have been Dr. Waldhausen. One of them. explained it to my mom when I was first diagnosed with it, when I was really, really young,
Okay.
as a bank of light switches, and they all have dimmers on them.
Yeah.
And so, like some of them will be all the way up, some of them will all the way down, some of
Yeah.
them will be like a quarter of the way. So that's kind of how it was explained to us, and I feel like that's the easiest way, like the easiest visual to give people is, it's like a bank of light switches. They all have dimmers, so some people are going to be a lot more affected by
Mhm.
certain things, and some people aren't. Like my mom is average height. She only had one surgery, I think.
Hmm.
And that was her spinal fusion. She has a limb difference, but it's like a quarter of an inch. And so she's like really not that affected. She didn't even know she had it until I was born. You know?
Yeah, that's a good analogy. I'd never heard that one, but it's exactly right. So, um, but yeah, and so for you specifically, I mean, obviously, one of your legs is shorter than the other, and one of your hips is dislocated, and that's pretty common.
Is
We
it
see,
dislocated or is it not fully formed?
well, one and the same. Yeah, so it's not fully formed, so it's dislocated. It's not. There's no the ball and socket are not in continuity.
Got it.
Um, and
So I
then,
think the most common question for that is, I get this all the time. Why can't I just have a hip replacement? Why is that not an option? To
well,
make my legs the same length.
it wouldn't make your leg it's the same length, because you have a
That
short
that's what
femur.
I tell people.
You have a short femur, and as long as your hip's not bothering you, then a hip replacement is not. It would be very. It's not. So hip replacements come in varying levels of difficulty. For an arthritic hip in a 60-something-year-old, or that's a relatively straightforward procedure. It's pretty cookie cutter. That's why the surgeons can do 5 to 6 in a day. But for yours, because of the way the anatomy is and the bones are not aligned at all, it'd be a much bigger endeavor to get your hip realigned and then put the prosthetic hip in. And it could be done theoretically, but because of we in surgery, and we can talk about this more with regard to your spine. There's everything's a risk benefit, and so if your hip's not bothering you and you're getting around pretty well like you do, then why do a surgery that could just make it could get infected, it could redislocate, it could have all kinds of, you get a nerve injury, there's all kinds of stuff that can happen. So
Not only that, but like I've had 43 surgeries. I
yeah,
don't really want to go in for 44.
yeah.
44 is not ideal.
And I would say it wouldn't be just 44. There's a good chance it would be 45, 46, 47, right? So
I
that's
think,
why we don't. Yeah. So unless it's really a problem for you, you're better off not doing it.
yeah.
I will say though that there are certain places and centers that are more aggressive about those kinds of problems, and so when you were younger, they might have tried to put the hip back in and reconstruct it and get your legs out to length, and which would have been literally probably would have been another 6 or 7 surgeries easily,
For what? Why?
because people want to look as quote unquote normal as possible.
Okay, but like at that point, for me, that's pointless. Like, my back would still not look quote normal. Like
Yeah,
it wouldn't. We're just not there. So that's the leg issue.
yeah.
Uh, Moving on to
Yeah,
your
but it is a whole.
specialty.
I mean, to your audience, though, it is a big cultural consideration for some
Yes.
families.
Yeah,
And
that's
I
true.
don't know, at some point, if you want, we can get into that. But because I mean, a lot of little people that I take care of, this is a big discussion and point with
Mm,
limb lengthenings, limb reconstructions, and that sort of thing. So anyway, but
interesting.
yeah, but we're talking about you right now.
We're talking about me. So, um, your focus, because you weren't my leg hip man. That was not your job. That was Mosca.
Yeah,
Yeah.
Dr. Moscow.
Um, Shout out to Dr. Mosca. Love him. Uh, so you were spine, talk a little bit about my spine, why it does what it does, why she has a mind of her own.
Yeah, boy. So I will say that your spine deformity it was extremely complicated and still is in many ways. And so just kind of a little background education. So the earlier spine deformity presents, the more likely it is to be a long-term problem, and the more difficult it becomes to kind of take care of it. On top of that, your spine, we use the form deformity, okay, spine deformity, is what we call kyphotic, meaning that it's a forward bend in the spine. You did have a little scoliosis as well, but really the primary issue, so scoliosis is side to side. So if I'm looking at someone from the front, you have a curvature from the side to side. Kyphosis, if you turn sideways, it bends forward. So that's why you kind of have that, prominence on your back. And so kyphotic deformities are much more challenging, especially when they present at age 1 or younger, right, as in infancy. So
It presented at birth. I
yeah,
technically was diagnosed unofficially with it the day I was born, and
yeah,
the specialist that they brought in to tell my mom that I had it, like 6 hours after I was born. Keep in mind she's 23 at this point. She's my age now, which is can't imagine. And she was told that he went over to his desk, he grabbed a book off a bookshelf, flipped to a page of a little person in a circus, and said, "This is all your daughter will ever be good for."
that's
And he was like, "I know what she has, and if she survives, this is all she's ever gonna do in life." And he said, "And that's if you're lucky, if she survives."
please tell me that wasn't one of my former partners. Um,
It wasn't. He's dead now.
okay, well that's too bad. Yeah, you kind of hear those stories.
That wasn't at Children's either. I will say that.
Yeah. Oh,
That
well,
wasn't at Children's.
yeah, it was probably where you were born. So, which means that it's not an orthopedic surgeon, and
I don't know
or
what his specialty was, but
yeah.
it wasn't bedside manner. I can say that.
No, 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 not at all. And and one thing you kind of learn over time is you never say never, and you try to lay out the facts as clearly as possible, and then say we'll do everything we can to make sure things go as well as possible. But
Yeah, that was not
back
what he said.
yeah. So, but this. So anyway, back to your spine. It's
Yeah.
the problem with those spine deformities specifically. So scoliosis can cause pulmonary problems. Kyphosis can cause pulmonary problems, but it can also result in paralysis. So you and I were talking earlier that if these are left untreated, the natural history is that you would likely become paralyzed. Meaning that if we did nothing, that the spine deformity would progress. It would stretch out your spinal cord to the point that it no longer worked.
Would it paralyze me, or would I pass away from this eventually?
No, you would be paralyzed. Yeah, so you
Love
would,
that.
in the level of your, deform your spine, your kyphosis was higher in the thoracic spine. So that would mean that you'd probably have no feeling from kind of just around your waist down, maybe a little higher than that, and you wouldn't be able to go to the bathroom on your own. You wouldn't be able to walk. You wouldn't feel anything. People who are paralyzed are more prone to having dying younger because of complications from those things. But
Yep. So at
yeah,
that point, I would have had a spinal cord injury and SCI.
yes, yeah, I
Okay.
think so. And so that's why when you met Dr. Song, my partner and mentor in Seattle, he was very aggressive about trying to take care of it. And it happened to be at the time there were some new technologies coming out, which you fondly know as the Vector. So yeah, so the Vector is what it stands for: vertical expandable prosthetic titanium rib. It was originally designed to open up the chest as a rib construct,
Oh.
but it quickly got adapted into using for spine deformities because of its expandable nature. And so before that, we would just fuse the spine, and then your spine would never grow. So if you think about the spine of a 1 year old compared to how long your spine is now, your chest would be about that big, right? It'd be
Mhm.
tiny. It would be, on the order of 10 centimeters, so,
But
five.
everything else would keep growing.
Yes, but everything else would be growing, but you'd have a 6 inch, torso.
Yeah.
And so clearly that's not compatible with life either. And so that's why this quote of growing rod technology was revolutionary at the time. And so you were really amongst the first, patients to have these put in. I think you were the first in Seattle.
What?
Yeah, I think you were the first in Seattle.
I know I was in the FDA trial.
Yes, yeah, because it wasn't even FDA approved, and so had a compassionate
You
use.
guys really were like, just shove it in her. We'll figure it out.
Well, I mean, it was it wasn't quite that cavalier, but it was well approved, right? I mean, you were really in the absence of any better options, then that's
Yeah.
that's why you do kind of you do these it's not really a trial, but an unapproved it was approved. It was done under the FDA
Sure.
supervision. It's what we call an
Sure.
investigational new device, an IND. So, yeah, but you had it that, and I would say around the country there were only maybe two or three other centers that were putting these in at the time. So,
Whoa.
yeah, Dr. Song was very much on the leading edge of this technology, and you
Wow.
were the first in Seattle. So, yeah, I mean and so that what happens then is that needs to be expanded every 6 to 8 months. At the time, we were doing it every 6 months, so that's why you had this. I think you were an April October schedule, if I remember right.
I
So
was.
and so, but then we realized you probably didn't have to do it quite as often, and so you could, by doing it a little less often, you have quite a few less surgeries.
A few,
Um,
but like we tried, and
yeah.
my pain was through the roof if you
Yeah, if you
waited.
would, yeah,
So we had to, what a lot of people don't realize is like, yes, recovering from surgery hurts, obviously. You're being, for a lack of a better term, cut open and then sewn back together. But for me, the recovery pain was less than the pain I was going through before surgery. So surgery was kind of a relief for me,
mm,
although I was in almost a constant state of recovering from surgery. Um, I was still like in so much pain that I got to the point when I was older that I was like, yeah, I'm hurting. I just need surgery. I'm fine.
yeah,
Like I was just, and I thought that was normal. I was like, what do you mean? What do you mean you don't have to go through surgery? Like I was just so used to it because it happened from the age of 1 on.
yeah,
So when he says we pushed it back or we tried to do it less often, it means like by a few weeks. Like it wasn't like
yeah. It didn't really
let's
work.
skip this one. Like it didn't really work as well as I think we hoped it would. Because I was in so much pain that we were like, we just gotta do it. Gotta
Yep.
put her in for another one.
Yeah, and everyone's a little bit different. I mean, you weren't the only one who, there was, and I don't know that anyone really could explain this phenomenon, but as you kind of started growing to the point where you need your rods expanded, many of the kids I took care of started having, back pain with that, and as soon as you lengthened them, it went away.
Yep,
So you were not alone in
every
that.
time.
Yeah. So yeah, but it was more than that. It was so you would have the lengthenings, but at some point you outgrew the rods, so we'd have to
Mhm.
replace them with longer ones. So that's another reason to have surgery. And then some, the rods. I think at some point ended up, they kind of they can start pulling out, dislodging, and then you have to
Yeah, I
replace
had
them.
several times when I didn't break a rod, but it
Yeah,
came loose
yeah,
somehow, and it didn't erode through the skin, which was great. I had that happen later. Not fun. But it did. I remember you could see the rods in my back because I was so tiny and the skin was so thin. Which my mom also did want me to have you touch on, which the skin being so thin and that presenting a risk during surgeries as well. Um, but at one point, you could see my left rod, and you were like, "See that? See how I touch it and it's moving? That's not what it's supposed to do."
No, no.
You were like, "Do you see how this is literally floating right here? We need to get her in." You were like, "This is not. It's supposed to be stationary. Not supposed to be floating like that."
Yeah, well, and that's what makes kyphosis so challenging with growing rods, because you're trying to go up and over a curve, and then basically on you,
Yeah.
you're basically relying your body weight's pulling away from the rods, and that's why Dr. Song at one point tried to go up through your chest, through the between the ribs, and then so instead of coming up and over, he was coming up underneath.
What was that?
That was he and Dr. Waldhausen did that, yeah. So that was before I started taking care of you.
That was crazy.
Yeah.
Well, so let's back up a little bit. My syndrome is called Conradi-Hunermann syndrome.
Yes.
How rare is it? I've gotten mixed answers.
Yeah, I mean it's one of the more rare skeletal dysplasia. So I would say it's probably on the order of 1 in 40,000 live births, maybe less, might be 100,000. It's pretty rare. So if you think about more, or more common like Down syndrome, that's probably 1 in 3,000, 1 in 2,000. And that's relatively rare, right? I mean, people don't, you don't see people with Down syndrome around all over the place, right? Trisomy 21. But so it's probably, then if you kind of do the math, it's at least 10 times as rare as that, right?
Okay.
So it's pretty uncommon.
Okay. So I just wanted to get that out of the way. So you started operating on me when I was around 6 or 7 because Dr. Song was leaving.
I took over 2012. So, but I met you
Oh.
before that.
Okay. So you started when I was like 10.
Yeah, so I took care of you from a skeletal dysplasia standpoint, but your surgeons were Dr. Mosca and Dr. Song.
Okay. So if you were taking care of me from a skeletal dysplasia standpoint, what does that mean?
Yeah, so skeletal dysplasia are really a grouping of genetic conditions of bone. It's that affect bone growth, and that's both stature and then the way the shape of bones. Okay, and so then that can be spine, that can be legs, it could be arms. At least from an orthopedic standpoint. Also, chest wall can change with that as well, but. So the most common one is a condition known as achondroplasia. These are and they're little people. They're comfortable with the word dwarf, so that's if you want to think about Billy Barty is probably the most famous person with achondroplasia, and he's the one who's founded Little People of America. But there are literally at least 500 different conditions that identify with skeletal dysplasia, plus a few more that are related. So it's actually over 700 if you want to do a full count. Wow. So, but combined, 700 conditions combined. As I said before, that we talk about number per live birth. And that combined is still probably 1 in 5,000 or something like that, which is still more rare than conditions like Down syndrome and so forth. So you kind of lump them all together. And so we take care of these kids in a multidisciplinary care clinic. I work with genetics, I work with rehabilitation medicine, audiology, physical therapy, and so forth. So that's that side of it. And
so you weren't necessarily operating on me, but you took over after I was
kind of overseeing, kind of coordinating your care.
Okay.
As a person who knew more about your condition, or at least had a focused interest in your condition, maybe. What
can I say? I'm pretty interesting.
Yeah.
Um, so once I was about 10, you took over um
Yeah.
doing the surgeries every 6 months and expanding the rods so that I could grow and breathe and not die and not be paralyzed. So what was I, as a child, constantly recovering from surgery, basically? What was I not allowed to do that a medically typical child would be able to do? I know there's one big thing that you're going to say.
Well, there's one big thing I'm going to say. I'm not sure what that is, but you're probably thinking trampoline or something. But
Yep.
actually, it's not a total no-no. I just it's
What do
something
you
that we
mean?
advise kind of against. Um,
My
it's
whole life I was told that I was not allowed.
I that did not come from me. That came, um, to be fair, to be honest though, with kids who have these complex spine problems, I try to tell them to do everything they feel like they can do, safely.
Safely. Mm.
And that's most anything. I mean, your rods are probably not going to dislodge by doing a gentle jump on the trampoline by yourself,
Okay,
right?
I think the reason I was a hard no on the trampoline was because I was not about to do anything gentle on
Yeah,
there. Mm,
right.
nope, I'm kind of a daredevil, and I would have come up with a new trick about how I could like backflip onto the
Yes.
ground, and I think my mom was like, "Absolutely not."
Yeah. I mean, it's probably prudent not to do that, but
I'd be
so
more careful now.
yeah, but and we can probably talk a little bit about camp as well, and
How'd you know that was my next question?
yeah. So I mean, I remember they had the horseback riding, which
That was a
it
conversation.
yeah, well, yeah, but it really wasn't to me. The horseback riding it wasn't like you were out, barrel riding,
Yeah.
rodeo riding.
There wasn't any hard impact to
No, you
do.
were walking in a circle with a spotter on either side of you, right? And people were saying, well, and it was another, someone probably you remember, but a young boy who had a muscular dystrophy or something, and he was told all his life he couldn't go on a horse. And I'm like, why? This is why you're at camp. Go on the
Yes.
horse. And it was that, and it was almost like you let him on a trampoline, right? It was like it was the happiest day of his life that he could
Yeah.
ride on the horse. And so you're a kid once. And so my philosophy really is to, as long as it's, safe, let kids be kids. And there's a lot of sort of urban legend and misconception out there about kids with bone differences about what they can and can't do that are propagated and not really, necessarily true. So
Mm.
um,
So what you're saying is I can go skydiving.
that's your choice. You're an adult.
Okay. So
I
what
don't.
you're saying is if
think
I
you. I
call
think
you and
you.
I say
I think you
if
take.
I call you and I say, Dr. White, I now need surgery because my rod eroded through my back, and you say, what'd you do? And I say, went skydiving and landed wrong, you're not gonna be mad at me.
I mean, that's your choice. But I don't. I mean, the chance of that happening is extraordinarily low. I mean, I
Great.
assume you'd be going with someone who is trained and you're going to learn, and you're not just going to jump out of a plane and somehow haphazardly land on the ground upside down,
No.
right? So it's not as simple as skydiving. Now your health insurance rates are going to go way up, but other than that,
Thanks for looking out for that. Appreciate it. I know you want to see more of my content. That's why I started a Patreon just for you. If you subscribe to a monetary tier on my Patreon, you automatically get access to hours of unseen footage. Behind the scenes, post shows, weekly life updates, weekly private live streams, and of course, so many never before seen pictures and videos of Champ and Monty. So what are you waiting for? Head over to my Patreon and check out all of the perks that I have for you. So let's talk about camp. So I went to a camp from the age of 8 to like 17, called Camp Corey. It was one of the camps that I went to as a child, and it is a camp for kids with disabilities. It's in Mount Vernon,
It is.
Washington now.
Mm-hmm.
And I went there for a long, long time, had so much fun. And one thing that when I tell people they get shocked about is that you went with me.
Yes.
So you didn't go to every week with me, but you did go to camp with me. And I know that other kids who went, they were also your patients. But I want to know, well, you didn't just go for me, although I might want to believe that.
Of course, you are special. Yeah.
So what was the you didn't have to do that. Like what was the thought process behind wanting to go to camp?
Yeah. No. So camp. So a little shout out to Camp Corey. It's still, still going strong. I'm actually the chair of the medical advisory board for Camp Corey now.
I didn't know that.
Yeah, and so I'll be back there this summer. I still go back from Colorado, and go for the week for skeletal dysplasia, and it's still a ton of fun. The thing about camp, is that it is an opportunity to spend time with the kids I see in the hospital or in the clinic, but not in that space where we're not just talking about their medical issues. We actually just get to go out and have fun. And the best part about it was that, then for the whole next year, when people would come in from after camp, we could talk about camp stories, and then, yes, as the year went on, are you going back to camp the next year, and it gave us a common point that was not medical to talk about. And I got to outside of that hospital, I could be a little more kind of relaxed and goofy and whatever, right? And you could paint my nails and dress me up, and
Which I did. Which I did.
yes, you did, and dunk me in the dunk tank, and
I did that too.
you did that too. So and there's a lot of sing-alongs, and so it's just fun, right? It's just a way to get to know the kids, and actually their parents as well, in a venue outside of the medical setting. And I think it really helped develop stronger relationships and stronger bonds. And I would say, the fact that you and I still keep in touch of course, we spent a lot of time in the hospital and the clinic together, but we also had a lot of fun outside of that and at camp and other events. So
Yeah, I think camp you going to camp with me was really pivotal because as a child, like you said, I'm in and out of the hospital constantly, going in for not only surgeries but appointments all the time, at least once or twice a month, if not more often than that. And because I didn't just see you, I saw general surgery, I saw whatever Dr. Mosca's specialty is.
yeah,
I
Lord,
saw pulmonary, I saw cardiology, I saw
derm.
uh, dermatology, I saw internal medicine, I saw infectious disease. Oh, I saw
Ophthalmology.
infectious disease. I saw all of them, every
Mm-hmm.
single one. Neurology, every single one. So neurology was probably my least favorite. I apologize to all
They're a
neurosurgery
different
people out
breed.
there.
They're a different breed. Yeah.
They're a different breed, and I'm gonna have a neurosurgery resident who was my resident on here.
Oh, great.
The one that I kicked out of my room, that one.
Oh,
The one that I had a screaming match with. Oh yeah, I'm having him on. Anyways, so actually, I had a screaming match with him. You kicked him out.
oh,
That's how that went. Anyway, but I saw all of those specialties, if not more, probably more.
right.
And you and Dr. Goldberg, I think, were the only ones who went to camp with me.
Mm-hmm.
And it was a time where I didn't have to focus on when the next appointment was, when I didn't have to focus on when the next surgery was, when I didn't have to worry about, oh, I can't do that because Dr. White said no. If I needed to ask, I would just go up to you, be like, "Can I do this?" And 99% of the time, you were like, "Go for it," because I was safe and everything was adapted. and I was around kids who looked like me. And it was a super safe environment, and you were there. So I think it gave my mom an extra level of security that if anything did happen, not only would the counselors and medical staff there have an eye out for me, but also like you, the person who was actively seeing me and doing my surgeries, was also there to be able to make sure that I was okay and that I was safe and medically okay. And it did give me a chance to see you not in scrubs, which was nice. And paint your nails. And there's a great photo of me at the food fight, smashing a pie in your face,
Oh
which
yeah.
I love. I love that photo. And I think that photo really sums it up. That like it's a patient physician relationship, but it doesn't always have to be serious and sad and scary and all the rest. Like it can also be fun. And I wasn't scared of coming to see you in the hospital. I was more excited to like talk about, have you tell my mom about what we did at camp, and have you tell me what your favorite camp memory was. And so I think that was part of, in my opinion, now as an adult, it was part of bedside manner and having that relationship with the kid outside of a scary, sad, depressing hospital setting, that they're in all the time.
Yeah. Yeah, and
um,
yeah, that's pediatrics is a little bit different than adult medicine that
I
way too.
agree.
But it's a very special kind of opportunity to
Yeah.
make those relationships, and not just between me and you and you and other care providers there, but also and you can say other kids who kind of had a similar path, right?
Yep.
Yeah, and I don't know if I've told you this story, but I had two little boys who also had vector growing rods at the time, and they were roommates, and they just got to the story is more or less that, oh, why are you here? Oh, well, I have a spine problem. Oh, me too. Oh, I have these rods in my back. Oh, me too. And then it's like, oh, my doctor is Dr. White, and they go, oh, me too. And so like all of a sudden, these kids who had never met each other suddenly had this connection, and and could then share and relate. So
Well, like my one of my childhood best friends is McKenna,
yeah.
and she and I met at camp. And let me tell you something, we raised hell in that hospital. Every every single time we were there together, we were rolling around. At one point, our parents scheduled our surgeries back to back, so we were going in for surgery like 30 minutes apart. And as fate would have it, we were on the floor, uh, in we were a room away from each other, recovering. And so nurses hated us, because we would just, instead of FaceTiming each other, we would just yell, to the room next door. And they got so fed up, they just moved us in to the same room at some point, because they were like, "Please stop." But like if it wasn't for camp, would have never known her. I spent summers at her house. She spent summers at mine. We went to events together. We kicked off Seattle children's campaigns together. We were hired for the same events. Like we did make a wish stuff together. Like we've done everything together. And if it wasn't for camp, like she doesn't have anywhere near my disability. She's a metabolic, bone, condition, but she if it wasn't for camp, like we would have never met or connected or anything. I would have never known her. And that would be so sad if I didn't have those experiences. So it wasn't just about being able to be a kid and see my surgeon in a different, space. It was also about the relationships that I built through camp.
Mhm.
Fun fact, some of the kids that I met at camp 15 years ago are also disability activists now. So we are also still in the same
It's very
places.
empowering. It's a very empowering
It's true.
opportunity. And you'd see new kids who'd come to camp, and you would see in the course of a week that just the light bulb turn on, and the growth, and the
Mhm.
their ability to engage, and come out of that kind of that little shell that they had developed to protect themselves from all of the medical stuff that they'd been through. So, and
Yeah.
I even had another set of young girls who now they're probably your age actually, who and you probably would know them if I name them, but one of them had some real family problems and ended up moving in with another girl from camp because
Whoa.
so the one family took her in because the girls had become such good friends. And so
Oh.
it's these kind of relationships that's I think camp really, so that's if you want to bring it back to why I do camp, it's to engage with the kids, but also to watch this happen and just to see
Mhm.
this growth and this building of a community amongst the kids has been really really powerful.
I mean, that's why I would go back and volunteer as an adult. That's why I would do it now if I lived there and had the means to do so. I
Yeah.
would totally spend a summer there and and be a counselor. I think that would be so fun. Do you have a favorite camp memory with me?
Oh boy. Well, I remember. So I think after getting painted and so forth, I still have my badge. It's Doctor Lady Zebra Lady Bubbles. That you guys, there were three of you, and I can't remember who the other two
Oh,
were. You guys got to name me, and you each had one was Lady, one was Zebra, and one was Bubbles, and so that became my name, Doctor Lady Zebra Bubbles, for that
wow.
camp. It didn't last till the next year, but that was that kind of
That's pretty good. I don't remember that, but that does sound like me.
that.
I do
Yeah,
agree.
yeah. And always it's the dunk tank is always fun. The kids love
The
it,
dunk
and
tank is fun.
then and Cilio is so they
Yeah,
have
the
this thing
fifth
called
night.
Cilio Olympics. They call it Cilio, where basically it's a giant food fight. They've had to scale it back a little bit, but and then at the end, when we were up in Carnation, if you remember, the fire truck would come.
Oh, I remember.
Yeah, so and if you hadn't been to camp before, this was like a total sneak up, and the local fire company would come up and quote test the fire hydrant to make sure it was working, and so
Mm-hmm.
they loaded up and they had this big ladder truck that would then spray down, and so out on we had a big grass field, and you were
Huge.
covered in food and goo
Paint,
and paint
slime,
and so everyone would just go dance under the shower of this fire hose, and that was basically how you got cleaned off. And
basically.
and everyone would be out and they do the camp dance, and
And then it's
that
muddy,
I'm sorry.
and now it's muddy on the field. So not only are you covered in all that, but now like up to your shins, you have mud.
Yes,
So
but
every time.
that's always a special memory as well. So
Thank you so much for watching and listening to that amazing episode, which is part one of this two-part episode. I hope you loved it and had as much fun as we did filming. Please make sure to hit that subscribe button because it really does help the channel out. Comment down below on what is the most shocking thing from my childhood or the most interesting medical fact that you learned about my body. Give me a 5-star rating depending on where you're watching or listening because it really does help me out. Make sure to follow me on all my other platforms because I do post on Instagram, Facebook Reels, TikTok, and YouTube Shorts every single day. I have a YouTube vlog that comes out every Wednesday and a podcast episode here on The View from 4 feet and 3 inches out everywhere you listen to podcasts every single Sunday. In the next part of this episode that we will be releasing next week, we jump into my journey with halo traction, as well as my spinal fusion, why I had to have surgery after my final surgery was done, and what life looks like for me now. I also asked him a few of your questions that you've submitted via Instagram. So make sure to tune in next week for part 2. See you then. Bye!